Good evening, welcome to the Board of Health meeting, Monday, April 4th, 2022. Let's see, we'll get, Matt Foster will not be joining us this evening. So we'll jump right into some of the action items. First set would be the invoices for Crystal Rock, B&D Associates, reimbursement for Heather Doucette, our nurse, and reimbursement for Jean Marie Joyce for mileage and certifications.
So Heather was not able to get what she needed to get in, so we're gonna take Heather off of that list.
Gotcha.
And we'll do it for the next meeting.
All right, so I will entertain a motion to accept the invoices as presented.
Motion.
Okay, this motion, Lisa, second Lyons. All in favor, say, any discussions? Hearing none. All in favor, say aye. Aye. Okay, passes. Okay, so next up, we have disposal work permits. We have 9 Daisy Lane, 1730 Central Street, 1742 Central Street, 1792 Central Street, and 652 Oak Street, which is a repair. Okay, so these are them. I've taken a look at these. Have you had a chance to go through them?
Yep, I
Okay, great, thanks, Lisa.
Yep.
All right, I will make the motion that we accept the disposal work permits as presented. Do I hear a second?
Second.
Second, Lisa. Any discussion? Hearing none. All in favor, say aye.
Aye.
All right, it passes. Aye. Passes unanimously. That's part of that. Okay, next we have our food service permits. Smiles by the Mile, Mum on the Go, Lolly Jolly Waffles, Ellie's Treats, Casey's Curbside Bistro, Local Larry's Tacos, Time Traveling, Sweet 16 Ice Cream. Okay, those were all food trucks, and then for food and milk, we have Sam Smith and Ashland Dairy. So before we go to a vote, Jean Marie, you just want to give us just a quick recap of what the food truck process was?
Okay, so we had a food truck event over in Hanover, in which they had about 15 food trucks, of which 9 wanted to work in East Bridgewater. So we went over on March 22nd, or 25th, I forget which, and got applications, permit fees, and inspected them on the spot.
Great.
So 9 tricks in 2 hours.
So that sounds like it freed up some time in the
Yeah,
future, trying to,
It beats trying to run around and find them on the road.
excellent.
Yeah.
All right. Okay. All right, so I will entertain a motion to accept the food service permits as presented.
Motion.
Okay, this motion, Lisa. Second, Lyons. Any discussion? Hearing none. All in favor, say aye.
Aye.
Aye, so that passes. Okay. Installer permits. Blackbrook Excavation, South Shore Excavation, Track Enterprises, G.A. Flommer, Joseph Keogh. Those are all renewals, and we have one new, J Corp Unlimited. So this is their exam attached to
The last one, yeah.
yeah, okay. All right, so I will make a motion that we accept the installer permits as presented. Do I have a second?
Second.
Second, Lisa. Any discussion? Hearing none. All in favor, say aye.
Aye.
Aye, passes. Okay, then we have minutes from our March 21st meeting. Lisa, have you had a chance to review?
I read them.
Perfect, okay. And I'll entertain a motion to accept the minutes.
Second.
So that's motion Lyons, second Lisa. Any discussions? Hearing none, all in favor say aye. Aye, that passes. Okay, so that takes care of action items. We have a couple of discussion points. The first on the list is our beaver program on, and this one is proposed on Crescent Street. Sue or Jean Marie, do either one of you want to give us an update on that?
Whatever you want.
You can do it.
Well, go ahead.
So, I mean, so
Hey.
basically, we kept getting a call from an abutter on Crescent Street about a new beaver problem on Crescent Street. And if you remember, we talked about it like a couple months ago when the beaver guy doesn't work in the winter. So we emailed him, and he is back to work. And coincidentally, he was just in town and inspected our 2 Harvard Street contraptions. And while out there, they ran into Rob Ken, who told them about Crescent Street. So they went over to Crescent Street. And I forwarded you an email, and I printed it for Rob, a proposal they provided to Rob Ken for the Crescent Street culvert, which I hope will take care of that, about his concerns. So the only question is, and I did email Rob tonight, but it was after 3, so I'm not sure if he'll get it. It appears that it falls under the DPW because it's a culvert. You know, we had that whole problem with, like,
Yeah.
you know, whose jurisdiction is it, who pays for it. I mean, I'm sure we can all work collaboratively. We did that with Harvard Street, like, you know, we paid for some stuff, they paid for some stuff. But it looks like the quote that I sent you guys was actually addressed to Rob Ken at the DPW to do that work on the culvert on Crescent Street. So hopefully, one way or the other, it looks like, you know, whether it's the DPW or us, they can do that. It's just a matter of who's gonna pay for it, probably. Hopefully that alleviates some of the concerns of that about it. I also attached with that email, I printed it for Rob, I'm not sure if you saw it, Lisa, was a nice little flyer about the good that beavers
Yes.
do, and I think that maybe that's one
I
of
would
those
love a
things.
beaver.
Yeah, that's one of those things we can, we can put up on our Facebook page and share
Right.
as a nice little flyer, so,
Yeah, that'd be
in our website. So they have been to Harvard Street and inspected those devices, and they have been to Crescent Street. And I forwarded you the emails. Yeah, that little flyer, and I forwarded you the email so that you do now have Mike Callahan, who's the beaver specialist, you have his contact information also now.
I think we got a whole beaver file floating around here somewhere.
We do,
do.
yeah, there's a file in the drawer, yeah,
I think it's in my drawer.
yeah. We do.
Okay, all right, so, next, for discussion point is the bylaw and Board of Health regulation updates, just bringing everything together, but I think this is gonna be a push, you know, further discussion as we get closer.
So I did
to the-
catch, I tried to watch a little bit of your meeting, and I saw that you tabled it, and we're not gonna obviously make this meeting, but so what I was hoping we could do is, we have elections coming up, we're gonna have a new member.
Yep.
Maybe over the summer, work on a final draft, and then we'll have something for you to vote on for the fall town meeting.
Perfect.
You know, take Jerry Marie's concerns, have town council review them,
Excellent.
and then maybe the new member will put eyes on it too and have different ideas. I mean, I don't know, you know, so.
Okay, no, makes sense, great, thank you. Okay, next we have animal control. We have a new animal.
Talk about your conversation with.
Oh, yeah, well, we have, our old animal control person has moved to another town, so she's no longer doing it.
Former.
Former, yeah, Alexa. And, so it went out to bid, and they decided to pick Precision?
Precision Wildlife, yeah.
Precision-
Yeah, they're
I went, blah, Precision Wildlife, and they're basically doing it for a lot of different towns around. I just sat with him, talked to him last week about, because there's different roles for the Board of Health, there's different roles for police. So here it goes through the police, it's under the selectmen. But the notification of any human contact, i.e. rabies with bats or dogs or cats, always comes to the Board of Health. So I just wanted to make sure that it was a pretty seamless process without double notifications to our residents or whatever.
Barn inspections, them or us? Is that clarified?
The animal health inspector is the one who does the barn inspections for the Department of Public Health. And that will be done by Precision Wildlife.
Okay.
That might pop because there's been a epidemic of an avian flu, not H5N1, but another one. And what's happening is a lot of Department of Agriculture is actually putting down large flocks of chickens and ducks and geese because of it. It's highly contagious. So I don't know if we have huge populations of chickens here, but it might hit us in that respect.
And any issues in our abutter towns?
No, not that I know of. It's
So it
mostly
hasn't-
been North Shore, but I mean,
Okay.
a couple of, and they have large, like
Big farms.
100, 400 chickens, that volume, where they've had to put down the entire stock.
Yikes.
And when,
But I think they said it hasn't, nothing's gone to a human yet, so
Yeah.
it's, yeah.
no, but they're
Yeah.
concerned about it, so
Yeah.
that's one of the issues. So if that pops, I'll let you know. But that's about it. I just wanted to make sure that we had a pretty seamless responsibility, and we're doing fine with that. Next one, following up, is rabies clinic, which is,
So I put the flyer in front of you. So the reason I put the flyer in front of you is this year a little bit different than in past years. Actually, and that, actually not that different. A couple of years ago, actually, Bob Philbrick and I had the idea of doing some kind of a donation bin at the rabies clinic. And I think one year the Girl Scouts actually collected, like, gently used blankets and that kind of thing. So Bonnie MacArthur, our vet, her daughter Erin has joined her practice now, and she contacted me a few weeks ago to say they would like to have some kind of donation bin for shelters, and would that be a problem? I said I didn't think so, but put something together for me and I'll have the board approve it. So I thought she did a really nice job on this flyer.
Cute.
So, but the problem we might run into is I guess West Bridgewater is not having a rabies clinic this year. They don't have a vet, and we do
I'm
not.
sorry, who's-
West Bridgewater is not, and we've always accepted, other towns, so we may get a little inundated. So I did let Bonnie know that today, just if she's ordering her supplies, let her know we may see a little influx. So I told Erin that I just have you guys look at the flyer, make sure you didn't have a problem with them collecting donations. I didn't think you would. And we
So
would-
where's the ask for donations?
down the,
Very
right,
bottom.
it says we also be collecting donations of new pet items to be given to a local shelter. So,
Okay.
yep, so they'll
Did they
have some.
pick a shelter? No, they're not sure.
I don't know, they haven't designated which one yet, and I will tell you that Bonnie, every year, takes a portion of her proceeds and donates it back to, she did it to the Kitty Ranch one year, she did it to the Humane Society, not the whole thing, because she pays her helpers, but, she's always, very generous with the shelters.
So this hasn't gone to print, this is just a,
Nope, that's her, so we'll put it on the website and Facebook page once that you guys say that
Okay.
it looks good to you.
I don't know if they want to move the accepting donations or something a little more bolder.
Yep, we can tell
But, I
them,
mean, it's
certainly
just,
can,
you know,
yep.
I'm not a master of the obvious.
Yep.
I mean, I missed it, but,
I think they want to make sure people know that even if they can't bring a donation, they can still come with their $10.
Okay,
So I think
fair
that's why
enough.
they probably,
Sure,
because
okay.
people don't want to say, well, I can't afford to get, a new item.
no,
or-
understood. Okay.
And
All
then
right.
this year
Oh, that's
differently, it's something different this year too, is we have a set rain date already, because a couple of years ago, I think it might have been your first year
Yeah.
here, we had some storms coming in and we had to cancel, and we really scattered to try to find a new date. So this year, the rain date is the next day.
Gotcha. All right, very good.
hopefully no hurricane.
Yeah.
Okay, Jean Marie, any updates?
Update. I think I gave them to you.
Yep.
Basically, I did 3 site assessments, i.e. perk tests in holes. 813 Union, 31 Cider Mill, and 41 Tardy Terrace were assessed. 2 of my repairs, groundwater is 18 inches higher than we saw models. So it's really kind of popping right now. Repairs 652 Oak Street, and they wanted a crest of 3 feet to groundwater. New construction,
So Jean Marie, if I could just interrupt real quick.
Mhm.
The, where we were above the groundwater, what's the solution there?
in that one, that
That's
was the one at.
45 Latham Way, right?
Yeah.
Okay,
We went to a Presby, which allows you to be 2 feet to groundwater,
okay.
so we could do it still gravity fed with a smaller profile, basically. Sometimes what's happens is you might have bad soils from like 0 to 4 feet, and it keeps the groundwater down, and the minute you open a hole, like the size of this room,
It just
it pops
bubbles
through.
up.
Yeah, it's artesian,
Okay,
so.
okay, thanks.
Um,
I
That's okay. 20 Church Street was under repair and finished. 45 Latham Way, I finished this morning. 1000 Plymouth Street, our result with that one was he put a deed restriction and 3-bedroom design. He's gonna stay with that. The food truck event we talked about. Basically, any food trucks that had vents and ansel systems in them, I just put a note on the bottom that said you need to see the fire chief for an inspection before you operate in town, and just kind of shot them that way. Dunkin' Donuts follow-up. I was originally in there in, I believe it was probably in February. That time they didn't have certified people on staff, just one person who was the regional manager, and she takes care of 24 stores. I gave them 60 days to come in compliance, which is code. I went down today, which is 60 days were up, and they are not in compliance. Both stores did not have a certified person on staff the time I was there. New Bedford Street has one person certified. She only works the morning shift. She doesn't work 7 days a week. Plymouth Street, the certified person was on vacation and hadn't been in a week plus. So my question to the board is, I've gone as far as I can with them. I'm only allowed to let them have a 60-day extension. What does the board want to do? Do you want to give them another extension? Do you want to
So
move
is
the
it
next
because
board
of
meeting?
lack of staffing? Like, do we know what their staffing ratios are? Are they still understaffed and that's why they don't have any safe
They're not
certified?
really understaffed. I was there today and they had 3 people on staff and 4 people at North Bedford. That should be adequate for that.
But are they 3 full-time people, or are they 3 people that just randomly happen to work on a Monday?
I was in there at 2 o'clock, so I'm assuming those are the full-timers. That would not be school kids. And these people are older. They're not school children. They're not after-schoolers that are working there right now.
So the last time, your interaction was with the district manager, right, or the regional manager?
The regional manager, she was the only certified person.
Okay, so she was the only, now now these are individually owned though, are they not?
These 2 are owned by the same owner.
Cadet
Okay.
Enterprises.
And they're managed by this regional
Yes.
manager, okay, okay.
Was the owner CC'd on the notification, or just the manager?
The regional manager was. She said she owned it. I didn't question
Okay.
her on whether or not she did. I gave you what food code says. Food code wants a certified person on each shift. And in fact, the Plymouth Street person said there should be a certified person on each shift. I said, yes, there should be. So she knew the answers.
So I
They
think,
have classes once a month, so they've had 3 months now to get someone certified.
so Dunks run the classes once a month?
Yes.
Okay, so it's not like an on-demand thing where they can just go out back or
No, they,
pull it up on their
if they haven't been
www.
certified before, they have to go through the new training.
Okay,
If they've been certified before, they can take an online test.
gotcha, okay. So I would, you know, I know that it's a challenging environment out there to you know, to hire, retain, train frontline workers. So, you know, a 60-day extension is probably, in my opinion, you know, prudent, but I would say that we need to make sure that we're communicating not just with the region manager, but the owner, to Lisa's point, you know, on all communications going forward. You know, we need to make sure that they're, at least we're trying to communicate with them, whether they open it up and read it and absorb it and take action on it, that's up to them, but, you know, the next steps, it's you know, it's becoming more and more serious, the length of time. And then I don't know if you know, I know you tried to reach out to the regional manager today, we can try a couple more times, maybe it's something that we get on a conference call. You know, we just want to try to help them solve the problem as best we can.
I'm fine with that, but I just want to remind the board that they were closed because of problems, that a person
the
in
fruit
charge
flies,
would
right?
know about this. And we've have complaints.
Okay,
The number of complaints is kind of racking up out there. And that's all due to not having knowledgeable people on staff.
so again, I'll let Lisa comment on it as well, but you know, maybe after the meeting, we try to get everybody on that email and ask for a phone call ASAP.
How about if we do it 30 days? Because 2.
That's fair.
She said 2 of them have certifications, but they can't find them.
Well, 30 days might be an issue if the class is off. I mean, do
It's
we know
usually
what
online,
day?
yeah.
Yeah, I mean, say if it's next Tuesday, they're not gonna be able to get people, you know what I mean, squared away to be in the class then.
Well,
So if we do 30
They
days, we can
had
go
since
another 30
January.
to accumulate to 60.
Could I just make a
go
suggestion? Could we, so in 30 days is about our next meeting, could we ask them all, not only to work on it, but then to come in person at our next meeting
Yeah,
to,
I
so
mean,
that we
that's what
can
I'm saying.
discuss the issue, so maybe that will push them to get something done, so they don't have to come in front of you and say they haven't gotten anything done.
True.
that's
Yeah,
why I'm
a good
thinking
point.
that way too.
Yeah, I know, like, we've had a problem with another restaurant in town in the past, not the same one, and really when, it took us to actually have them come in to get them to really,
That's a good point.
you know, listen, and that was before TV too, so.
Right.
I
I mean,
you know.
I mean, I'd hate to
It is-
have them
yeah,
shut
and I
down, but
wanna
at the same
say
time, they're
They picked
only-
it up, they picked up this Dunkin' Donuts in the middle of the pandemic, but they did own other ones. They do own other ones previous to this. One of the owners is a local yokel, so I'm sure, I think it might be good to.
And I don't think we can assume.
And like I
just-
mentioned when Jean Marie first started, there's gonna be a learning curve, but I told her
Yeah, we know
because,
that.
for instance, there's other restaurants like Subway, I think there's only one certified person at Subway, and there's how many shifts at Subway?
Right.
So, because in the past, as part of their application process, it was just a requirement to have, a safe certified person on site. Didn't say for every shift, so I think there is gonna be other ones when she goes along and
Right.
finds some more. It's just that this one, we had a couple issues at, so then it came to the forefront,
I think that's the key.
yeah, but there's gonna be a learning curve this year. She's gonna find a couple more like that.
And I also think, without speaking to the actual owner, we can't convey just because someone's in a managerial role that they're conveying all this information. Like, they may say, hey, okay, well, let's take care of this problem myself and whatnot. I think
Right.
we need to kind of make sure everyone's in play before we issue a
And
close
these jobs
or
have wicked
fine
high
or-
turnovers, because you go get coffee and it's always a different person in there, but.
That's the other point, since they have such a high turnover, they need someone who knows what they're doing. So, I'll give them 30 days or appear before the board.
Okay.
Right.
Perfect.
That was it for me. I think.
I have one thing to add too. So Charlie sent out an email earlier, and I asked him if he wanted me to just bring it to your attention. A town meeting's coming up.
Yep.
I sent you guys the town
Yeah.
meeting thing. And there is no COVID protocol right now, but he was gonna have the board have a discussion regarding whether they had any concerns about COVID protocol for town meeting. He's not looking for any kind of voter decision. He just wanted to toss it around whether this cases are.
Meeting again before town meeting?
No, we are meeting, but they're trying to get things lined up way before then.
I mean, unless anything changes
Yeah, I
drastically,
mean-
I think it would be what the individual feels comfortable with and
Yeah,
and whatever
yeah,
guidance is out there from a
exactly.
CDC standpoint.
And it's hard because, people see the number that the cases are going up a little with wastewater, it's been on the news, but hospitalizations are still way down. The serious of the illnesses
Is
is
gone,
down.
yeah.
And East Bridgewater, I've only had 5 cases. I've had as much flu as I have COVID the last couple weeks, so,
Which we expected, yeah.
so.
I think what we can probably do is, A, have masks available if people need them at town meeting, and B, push the kits like 2 or 3 weeks before. I mean, I'm like, Easter's coming and vacation's coming and town meeting's coming, so if you need a kit just to feel comfortable, we have them free and available. That kind of a public health thing.
Okay. So when people are at the check-in table, they're checking people off the register, we can have, like, to your point, that's a good point, have the masks available. My dad's 83, 84, and,
Right.
when he goes out, he wears a mask.
Yeah,
And, depending on where I am, I may or may not, and then others, it's up to the individual, I think, at this point, unless something changes between now and then.
And I don't, with the good weather coming, I don't anticipate that it will.
No.
so.
and even if something does, we
And
still
they,
have masks available.
they posted about we have an abundance of tests that are gonna expire, so they put it back on the website today.
yeah.
I shared it on Facebook today, so I actually had an older gentleman in today that doesn't go on the computer, and he was looking for something else. He said, hey, do you need any COVID tests? So just been offering to people that I think might wanna have them at home. But that's not a bad idea, actually, to have boxes available for anyone that wants them at town meeting or election,
Because
just to
between
give them
Easter
out before the
holidays-
expiration date.
Right, and Easter holidays and vacation.
Okay.
But, yeah, other than that, I mean,
You're talking about the tests themselves, not the masks.
yeah, the test, yeah. Because,
And then have
maybe
masks
somebody will want to use it,
town meeting.
or something. Yeah, I hate to see them
Yeah,
throw it away.
I disagree with having masks at town meeting. I think people should bring their own masks, given the fact that if someone's sticking their hand in a box,
True,
it's a germ issue.
true.
Even if you're passing them, it's like, it's a kind of a contaminant.
He has some that are already wrapped.
Individual.
If you want me, I can stand there with Tom.
Or even just a note
Or
saying
you
masks
could be
available.
contaminated, Jean Marie.
Masks available upon request or
Yeah.
something, so that people don't see the box. Because I know even here, we had a box of masks on the table in the front, and a lot of people just assumed they were required because the box
Right.
was there. So maybe just a note saying, if masks are available upon request. If somebody walks in and says, oh my gosh, this room is way more crowded than
Yeah.
I thought,
That's a good
Right,
idea.
that's what I'm
know.
thinking too, if someone says, oh, I'm not comfortable, would you like a mask? You know,
'Cause usually they're pretty sparsely attended, but you never know.
with that coughing, hacking person.
Well, yeah, there's been a lot of
Unfortunately,
chitter
too sparsely.
Yeah,
Yeah.
they might be a little bit more attentive this year. I've seen a lot of chitter chatter about like sewer and all that stuff, so you never know.
No, the more the merrier.
And the only
Anything
other-
else?
The only one other thing I had is Heather is I was hoping to have him tonight, but she's working with Mr. Gentile in a babysitting class at the middle school, and she has reserved the second floor meeting room, actually the same day as town meeting, so we're not allowed to have hearings or meetings, but she can host a class, so she's gonna have a CPR class, I think at 4 o'clock that afternoon for a small group as part of her accreditation process. So she's gonna send us over some flyers that we can get out there to put out for people and.
So how does that work? It's just first come, first serve?
Yeah, so I think this particular first class, she says it's probably gonna be like 8 or 10 people or something for the CPR, and then the babysitting, she's only licensed to have so many kids per session, so it'll be first come, first serve with a certain age range.
So
And they have to be residents.
is it middle to junior, or, because middle goes down fairly young?
Yeah, I think it's usually geared toward like that 6th grade age for
Yeah.
that,
Okay.
for that class. And they, they do like I know my daughter took it, and they did a little bit of, CPR first aid type stuff, and, what to do in an emergency, and, prepping your emergency list and all that stuff, so I know that, she said she's got some dates nailed down, she's just waiting for the, final okay before she does her flyer up, and then she would get that to us to get the word out there. So,
When was that gonna be?
in May, so she's just waiting for some finalizations on the dates before she pinpoints it. But
Okay.
we'll get it on the website and Facebook, and I think probably Mr. Gentile, I'm assuming they'll probably send it home, like that little
I think
newsletter
it's
they
like
do.
that- Yeah, they do the electronic. one.
Yeah. So that's good that she's, doing some new and other things.
Is that something that we can offer to the teachers before school goes back?
Like
To have
CPR?
her,
Oh, yeah, absolutely. So I think,
I know they have to
We
be
did,
certified,
yeah.
but I don't know who certifies.
so 2 years ago, we hired a company to come in and do it, but if Heather is now gonna be licensed to instruct, then, she could.
We could
she
do it as like a courtesy, yeah.
Yeah, I think like all the coaches, and I think even the cafeteria, what do they call, the monitors?
Yeah.
or- Yeah. So, yeah. So, yeah, she's been exploring different things she could offer, so she's been talking to Nancy, I guess.
So that is a discussion, opening it up, or having a different session for the teachers, coaches?
No, she was just asking that, she was saying about, could we, and I said, I don't see why we couldn't, yeah.
Okay.
We've done it in the past, before, pre-COVID, we had classes
Yeah.
over at the senior center, I think. Because I know I took, town employees took it, so the girls we all took it upstairs.
Okay.
And it involved, I think it also involved some AED training. I think that's
All right.
all I have for my notes. I think that's it.
All set?
Yep.
Okay. All right, so I will entertain a motion to adjourn.
Do we just need to denote that we're not meeting the third Monday, and our next meeting will be
So, let's see, let me just make sure we get this right.
That May
May
2nd,
2nd, I think?
Okay, so, our next scheduled would have been on the 18th, which is a holiday. So then from there, our next scheduled meeting would be May 2nd.
And that will be Mr. Foster's last meeting.
That'll be Mr. Foster's last meeting, okay. All right. Thank you. Okay, so I will entertain a motion to adjourn.
Motion?
Yes, motion Lisa, second Lyons. Any discussion? Hearing none, all in favor say aye.
Aye.
Aye, so that concludes Board of Health meeting for Monday, April 4th, 2022. Thanks, everybody.